procedure needs a privacy. Okay? After that one, you can do hand washing. Okay, same, pre-procedure. Okay? You said you should make it sure that the patient say yes. Okay, for the suctioning. Okay. And there are two kinds of machine. This is like a very basic machine. Sir, who's going to arrange this one? Ask the technician. Okay? Most of nurses know this one when they're going, but most of the time, if there's a troubleshooting for this one, ask the technician. It's not your job. Make it sure. It's not your job again. Okay, call. So most probably, the only thing you have to memorize here, the on and off, and make it sure this one is sealed. Okay? This is the tubings, this is the bottle, and this is the pressure here. So what you're going to do is just on and off when you're going to put inside to the patient. Okay? This is like a little bit invasive, so you have to inform always. Tell the patient, I'm going to put this one, you're going to feel pressure. If you're going to feel that, just inform me. Okay? When you're going to go inside, if there is a resistance, stop for a while. You can withdraw a little bit and put. Okay? If there is a resistance. Okay. And also remember, if there is a suction, what should be the mostly color of the suction? It should be aqua mucus. It's clear, no? If like, for an example, green.
Phlegm.
What will be that one?
Phlegm.
Infection. If you have an upper respiratory tract infection, mostly your color is yellow, green. Remember that one? So you have to inform the nurse. Okay? When you inform the nurse, always make sure the nurse knows up. Okay? But most of the time, if the side is okay. If there's a respiratory, do their job, no, they're just eating.
Okay. So doctor, if it's normal, it's going to be green.
No, infection.
Clear.
The normal
Clear.
is what?
Clear. Parang yung sipon mong clear.
Yeah, you can see because this one is clear. Okay?
Clear or cloud?
Now, however,
where will the colors be reflected?
Here. There is a bundle when you're going to suction. Okay? So, making sure that the machine is working.
Ayun. Gusto ko daya lang ako.
Return demo.
Patient. Always remember, when you're going to start, it should be what? It should be with the
Level
of the hips. Hips ko na ba ito?
Bakit?
Nasaway sa kanila. Saan yung itong black?
Then on this one is always up.
Kasi rose ganito yun.
Okay? Next is what? It should be what? Lock with
Wala
the
silang
side
prepare.
legs.
Supposed to be black naman talaga dapat lahat.
Lock the
Masyadong girlish yung sa
Now, what you're going to do for this one, for the suction, is first is what? You have to prepare. In hospitals, they have a suction kit. Suction kit. When we have the suction kit, it's like a box. Everything is inside. So you don't have any to worry. But here, I think we don't have a suction kit. So most probably inside the suction kit, there is like an extra pad. Okay? Extra pad. There will be like a syringe, and there will be a tissue. Okay? And there will be the suction catheter. Now, there are two types that we're going to what? Suction the patient. It can be in nose, nasopharyngeal, or the mouth, oropharyngeal. So for this one, most of the time, what we're using for this catheter suction is the nasopharyngeal. This one. The oropharyngeal, have you seen that? We call this tube, long tube for the young bird. The one, this one, going to extract to the patient. Okay? we're going to also at the same time with the oxygen. So if the patient have this tube here, leave it. If there is a mask, you just have to put beside. Okay? So at least they can breathe. Okay, it's not easy to breathe when you suction. Try. Okay? Okay, first is you're going to explain already, then after that one, you can what? Hand washing. After hand washing, do the globbings. Okay, for the globbings, you should at least once.
Latex yata.
Okay? So, when you open the globbing, so if it's surgical, you know how to gloves for surgical, right?
Yeah.
Do this one. You have to do that one. Okay. So you're gloved already. Okay, so what is my dominant for me is I'm a left-handed. Okay, so most of the time I'm going to work with my right hand. So before that one, I can use this one. Mostly I can open this one. Then put at least 50 or 100 cc for the suction. You prepare. Okay? Now, for this one, you have already prepared this one and this one is open already. Okay, at least.
Bakit
So at
ganun?
least you have a gel.
KY jelly.
KY jelly. Water soluble. But for the oropharyngeal, no. Okay? So what I'm going to do is I'm going to get this one. You can hold here because it's still clean. It is what? Sterile. Okay? This one is clean. You can control, you can do that one. So, stretch mo. Now, when I started to hold
Kasi
this
dapat
one, it's
container
clean
lang.
already. So, the sterile is only here. Okay? Now, if I have already a gel or something, I can use that one. Okay? When you're going to do that one, the positioning of the patient, the best is Fowler's or semi-Fowler's. Okay, because it's not easy to break when the patient is in supine. Plus, there is a phlegm. Okay? Now, if I already put
Kawawa
the
naman. Kasi Mrs. Johnson.
gel, make it sure that the basic for this one, in order for you to what? Measure. Okay? At least here until to the mandible. For the older person, it's like at least 5 to 6 inches. Okay? For the if it's become like a child, it's like 4 to 5. Then for the child, it's what? 1 to 3. So it depends. So you just have to make it sure. So, for example, okay? This one, it's still with oxygen, alright? I could put it here. So the patient can still have the oxygen. Now, I already have the gel. Okay? Now, I on. Then, I put inside to this one. Okay? Then after you have this one, you can suck. Okay? Then put inside again.
How many inches, sir?
At least 5 to 6 inches for the old one. But if you want to the under oro here, at least 8 inches. Now, if you find that there is a resistance, stop. Stop if there is a resistance. Okay? Now, when you put this one, okay, should be an intermittent, then circular motion, then stop. At least 5 to 10. Because if you suck for a longer time, patient will what? Mauubos yung oxygen. Then again, circular motion. Circular motion.
If going out, circular motion.
Yes, circular motion. Then again, you can use the
Water to clean.
yeah. Yeah, you can look at that one. It's sucking. So it's okay now, it's sucking. You can put again a gel, and you can use the other one.
Other side.
At least you have to take at least 1 to 2 minutes na interval because it's not easy. Okay? Now again, it's already, you put the gel again, you have to put to the mouth. I know, nose, Then after that one, intermittent circular motion. Circular motion. Circular motion. Okay, don't do this one.
Sir, what if the patient sneezing during like that?
You have to take deep breathing. Okay?
Ah.
So, don't do this one. What will happen? It will be longer one. So that's why it should be circular. Why circular? Para whatever in the side, it can suck.
And
Okay?
How far does it need to
Yeah,
go?
yeah. This one, it's already what? There is a resistance. So, circular motion. Circular motion. Okay? So after that one, when you're going to finish that one, okay, you can throw this one directly. There is two types. It depends. Some patient is going to reuse this one again. However, the most of the time, throw directly. Okay, throw directly. So if you can remove, you can use this one. Take it off. Now, for the nasopharyngeal, it's almost the same. But the difference for nasopharyngeal, because we have this suction, we just only outside. Here, no? So, no need to do the gel. Okay, that's the difference. Don't put gel. Yeah, and ask the patient to, because there is salivation here, no? It's like that. Then you have to do the inside to
How
side.
deep is it? How deep?
It's only outside.
Just in the
It's
mouth.
the outside.
it's like same
But
like
if you want to go inside, use the tube. But the one that we're using for that one here, it's the young coil or the tube, long tube. So it's only outside. Now, after this one, what you can do is you can assist the patient to do the oral care. Okay? You can do the oral care. Okay, after that one, you can remove this one, put this one again. Okay. After this one, you have to throw directly to bin. I think by bin dyan, wala. Then when you can, put it back this one. Okay? However, there's a difference. This suction machine is portable. In the hospital, iba yung social. Okay? Oxygen, and there is a side, this one is the what? The suction. You can see that one, there is like a button for this one. This one is a portable. But in the hospitals, they have already in the upper part. That is more easier for that one. Okay? Now, the next you're going to do is what? You have to do the what? You make it sure that the patient is in the what? Good positioning, good condition. If the patient can talk, you can ask what they want. If they want to lower this one or they want positioning itself. But after this one, you can ask what the patient wants. Because at the end, it's always safety. Now, what you're going... Yes, what else? Yeah? Yeah, whatever. If it's mouth, if there's an abscess, you can put. Okay, what kind of phlegm? If there is any changes for the SpO2 or the oxygen day, SpO2, the normal achieve 95 to 100. Am I right? Before, when we start, before we're going to hear that there is a what? Phlegm. After that one, it should be in the higher side because you remove the phlegm.
So how much from 95? Isn't it too low?
95 to 100, that is the normal one. But if it's like 91 to 95, there is a problem. But it should be, if it's 85, there should be a problem for that brain. Okay? 85 to 100, this should be your grade. No, I always remember, what is the normal? That should be my grade. 95 to 100. Okay? Documentation through, then sync. Then, that one. Okay? Now, for nebulization,
Why?
water ka lang. Okay?
may ilalagay.
Yes.
Kasi yung iba,
Yeah,
it
but you have to use this one when you're using the, when you're getting the saline water and for the medication. Most of them have needle. Okay, you should use needle. We don't have needle here. So, like for example, this is, at least mostly we're going to do this one is 3 cc. 3 cc. Then put it here. Then mostly 1 cc of medication.
It takes forever to finish that much.
Yeah. Okay? And it's easy. On mo lang. Okay? There should be a mist. Can you see? May lumabas na genie.
Close you can, yeah.
If you cannot see, go to the darker.
Yeah.
Because it's light, yeah. So you have to go to the darker so you can see. Now, this one is working. Now you're going to instruct the patient to put in the mouth. And inhale.
Exhale.
Then after segurata, exhale. Okay? Inhale again. Then exhale. Until it's going to finish. Now, not everything during where you're going to give the medication, minsan meron natitira. There's some one. Please don't use that one. Throw. Please throw. Because for us, sayang. Please throw that one. Because it's considered this should be discarded. What will happen if there's a new order? It's different medication, no?
Yeah.
You want to save. But mostly in this one, it's almost the same medication. So at least this one is what? You have to give it to the patient. Then after that one, patient can relax and can cough if you want. You can give this one mostly before CPT. It helps. Chest physiotherapy. You can give this one first.
Because it opens up.
Yes, it softens the blend.
Blend.
Then after you finish,
Hands.
okay? Careful.
Kasi pag nag-backflow ng
Yes.
blood,
What will
Supposed to reach a little bit higher, but the good thing it's locked.
okay.
So you have to get the hands in position. Pangit kinakain.
putol-putol kasi yung
So,
kamay.
putol kasing kamay. Then after you go up. Okay. Up. Then lower. Can get the hand of the patient and put. Okay. Okay, and you can remove the
Blanket.
privacy blanket, and you can. Okay, and you can close it here. Okay. Now, after this one, you can put it here. Or you can put it
And
before,
switch it on.
then on.
Check.
Okay, you can on. Then if there is a machine for regulator, you can put it there. Because there is a machine, you just put this one, it will regulate on the own. So you don't have to what?
But in
down for several
Philippines,
minutes.
it's manual.
Okay? So, always safety of the patient. Then lower, then you can do this one. Just as what the patients need. Okay? Now, next what you're going to do, if you're going to, and this should be, this one is lowered. Okay? When it's going to be lowered, make it sure when it's going to in lower side in order to the gravity. And it should be this one, at least 10 cm, it's down. Okay?
Tapos
Now,
ilagay
how
mo
you going
pataas,
to remove
no?
this one? When you're going to remove this one, no? Open, close, open, close. Okay. Is this one is one? Okay. Sometimes we're using this one. However, for the standardization, you have
Single
to
use.
use what? The cylinder. So for an example, this is my cylinder. So I have to what? I have a paper. I put the paper here or tissue because it will what?
It will
Speed. It's not easy. Then I have to put it here. Then go. Then after I finish, close. Then I have to put it back. You can see, meron siyang dito. Pwede mo siyang ilagay dyan. Okay, and some of them, meron silang ganito, dapat naka-close yan. Huwag na natin i-close siya, baka di na ma-open. Yan. And you have to close. Now, I am going to go this one and go to at least ito pa. Level sa iron.